Hi, my name is Aaron. I'm currently a resident physician at Mass General Hospital based in Boston, and I'm also a patient with thalassemia. I don't entirely recall the circumstances around my initial diagnosis. I know I was very young. It happened when I was less than 1 year old. My parents started noticing that I was not feeling myself, and so when they took me to a doctor, they ran some tests and they told my parents that I have thalassemia, which is a diagnosis that they had never heard of before. Thalassemia is a blood disorder that is the result of a genetic change in one of the genes responsible for in the production of red blood cells. So as a consequence of this genetic change, the red blood cells are not healthy, and so patients with thalassemia need to undergo regular blood transfusions with blood donated by blood donors. One of the consequences and one of the complications of thalassemia is that with all these repeated blood transfusions comes a lot of iron, and so patients are prone to iron overload, which can lead to a lot of problems with various organs, including the heart and the liver. And so they need extra medication and extra attention to their iron to prevent the long-term side effects and consequences of blood transfusions as well. Having thalassemia has made it really important for me to consider where I was going to be when geographically when I started my medical training. I wanted to make sure that I was going to be treated at a center of excellence for thalassemia, and that the physicians who would be taking over my care were those who would be very proficient in the field of hematology and gene therapy. I don't think that I would be a doctor without this diagnosis. I'm not sure how I would have stumbled upon the field of medicine otherwise. And it's all because I had a great pediatric hematologist growing up who really understood me and my family and our needs, and had a really holistic approach to my medical health. I think indirectly, having thalassemia has helped me to empathize and connect with patients that I encounter on a day-to-day basis. And I think that, moving forward as I pursue the field of hematology in the future, I think that having thalassemia will also inform the way that I approach patient care. I was really honored to be the essentially face of thalassemia for that video series and share my experience. And I also wanted to take that opportunity to share with other patients and families who are dealing with thalassemia the strategies that I have used in my life to improve my own medical care, to pursue my dreams despite having something that most people would think of as intrusive. So I thought of that as a tremendous opportunity for me to share my experience and to help others who are struggling with it as well. I think nowadays I'm generally quite open. I've publicly shared my story with thalassemia, and I don't hold back when people ask me about it. I think when I was growing up, I was a lot more hesitant and worried that it might change the way that people think about me. But over the years, I've come to find that people really appreciate hearing about my unique story, and good friends are good friends regardless of whether or not I have thalassemia, and it's helped me to grow more confident in my diagnosis and realize that it's just one part of my life and I don't need to be defined by my diagnosis. I think the rebranding is an excellent change moving forward, and I'll be really excited to see the other types of diseases that are encompassed by the organization. I think what has really been helpful for me and my peers with thalassemia is the creation of community. And, you know, as somebody living with thalassemia, I'm aware that this is not a disease that's very common in the United States. And so any way that we're able to connect, whether it be through social media or annual conferences or forums where we can share our stories and ask our questions, are always welcome. This Bleeding Disorders Awareness Month, I'm starting a conversation about transitions of care for patients with rare genetic disorders.